Hi, today what we're going to discuss is these marionette lines and why they are happening, how we can treat them, and if they can be prevented. I'm here to give you all the information that you need to make the best decisions in your anti-aging and aesthetic journey. My name is Chantel Ward, and I'm a registered nurse specializing in medical aesthetics. Let's get into it. Let's understand why these marionette lines appear. Marionette lines, what are they? Marionette lines are these lines that appear as we age that make us look sad or make us look like we have resting bitch face. Why do they appear? Well, there's a number of things that happen. So if you look here on Taylor, well, first of all, there's two muscles. There's the muscle that goes around the mouth, and then you have all of these opposing muscles. And the specific one is called the DAO. That muscle actually, as we age, starts contracting or gets very active and pulls down the side of the mouth. So it gives you that appearance of being a little bit sad. The other thing that's happening is that we lose a little bit of volume. So you've got this muscle pulling down, then we have this natural fat pad when we're young, when we have this beautiful round face and everything's kind of nice and full. That starts diminishing with age. And that could be because it's hereditary, you've had excessive weight loss, you have been ill, you're on medication, but it does just happen. We do lose these specific fat pads throughout our face, and primarily with respect to the marionette lines in this zone right here. So that is why it's happening. You've got a whole bunch of little things going on. The other thing that could be making these marionette lines look a little bit more dramatic is that this muscle on the chin also contracts upward. So you have this pushing up, you have this pulling down, and you have volume loss. So you can't prevent it. What we can do is treat it, or if you're starting to see these little lines appear, we can do things like neuromodulators, but we can talk about that a little bit more further down into the video. There are several treatment options for treating these marionette lines. So one of the easiest things to do is if you do have a strong muscle or a DAO that's pulling down, we can put just a little bit of a neuromodulator such as Botox or Xeomin to stop that muscle from contracting, and it will allow that side of the mouth, the little crease there, to pop back up. If you have volume loss, then we need to consider something such as a dermal filler, which is a hyaluronic acid. And we want to choose the right one because we want to make sure it's soft enough that it doesn't feel lumpy, but it replenishes that volume loss. So rather than having this concave appearance around the side of the mouth that accentuates the marionette line, we can actually go in and create a very small elevation of the tissue, a softening, so you don't see that shadowing or that concaveness of that area just under the marionette. We could also do things like biostimulation. So if you're not a fan of a hyaluronic acid or a dermal filler, we could use something that biostimulates. That biostimulator, it could be a calcium hydroxyapatite, known as Radiofrequency. There are other products that are coming out down the pipeline that should be approved soon in North America called Harmonica. It's a combination of calcium hydroxyapatite and hyaluronic acid. Worldwide, there are so many options, but in Canada, in the US, there are certain products that are approved that we can use. So doing that biostimulation will give you that immediate effect of softening, but over the course of 2 months, 3 months, 6 months, it's going to start building that scaffold of type 1 and type 2 collagen along with elastin that's going to soften that area. We've already talked a little bit about Botox or a neuromodulator. So by relaxing this muscle, you allow the sides of the mouth around that very strong muscle of the orbicularis, or around the mouth, to actually pull up the side of the mouth as well. doing a dermal filler and a neuromodulator in conjunction or combined is a very common strategy. We want to deal with the pull down and we want to deal with that volume loss. By the way, what is the difference between a hyaluronic acid dermal filler and a biostimulator like Radiesse or Sculptra or Harmonica? A dermal filler is a hyaluronic acid that actually can be injected and replenishes volume loss. Our body will naturally metabolize that over time, and as it metabolizes, the marionette line or that loss of volume will reappear. The longevity of that dermal filler can be anywhere between 5 months, 6 months, 9 months, 12 months, depending on the product chosen, but we want to make sure that we're not choosing a really dense, strong product in a very malleable area. And what I mean by that is this is a very busy area, talking, eating, chewing, smiling. We don't want it to be evident that you've got dermal filler there. So we just deal with the shadows. We just replenish volume loss. A biostimulator such as Radiesse or Harmonica, well, Radiesse, let's talk about Radiesse. It's a calcium hydroxyapatite. And what it does is it lays down onto the tissue once we inject it, and it sits there on your existing collagen and tissue, and it starts what's called a wound healing cascade. It sends in all these little cells and macrophages to start repairing or going, hey, what's this foreign body here? Not that it's a dangerous foreign body, but then it starts building the collagen. And what you need to know is that we build type 1 and type 2 collagen. Type 1 collagen is the easiest thing to build. The type 2 is really kind of the secret sauce with Radiesse. So the two combined with the CAHA or the Radiesse stimulates type 1 and type 2 collagen and elastin. That's why we call it regenerative or a biostimulator. So a dermal filler, we inject and it just replenishes volume loss. A biostimulator actually stimulates your own collagen. So doing an injection of a biostimulator or a hyaluronic acid, we can use what's called a combination therapy. We've already talked a little bit about it. We will do Botox or a Xeomin or some of the other products that are on the market along with the dermal filler or the Radiesse. We really do want to do both treatments at the same time, especially if you've got that muscle pulling down. The way we assess it is we get you to make a silly face like, ee. You can see how I'm getting the little pull down here, and that's where we would inject it. And if you try to do E after that's done, obviously I need it done, then it's gonna stop pulling down and it just gives you that happier frown. Other treatment options. Let's talk about other treatment options. There's so many things out on the market. So if we know it's muscle, we've got to use a neuromodulator. If we know it's volume, then we need to deal with the volume loss. But if it's related to the laxity of the tissue pulling away from the bone structure, then we may consider some other avenues along with treating our DAOs with a Botox or our fillers. So we could do something like an RF microneedling. If you're mild laxity, and if we can tighten that tissue up, it will actually soften this area. We could use ultrasound. So we can do microfocused ultrasound or focused ultrasound. They are two different things. I'm a fan of microfocused ultrasound, which device name is called Ultherapy. It actually produces collagen, and that's why it got approval by the FDA and Health Canada for lifting the tissue. So really what's happening is we visualize through an ultrasound, just like if you were having an abdominal ultrasound or a baby ultrasound, we can see all the layers of the skin. And once I know I am on top of that connective tissue called SMAS, and we can talk about SMAS forever, that's that connective tissue that adheres to the periosteum, and we can actually deliver the energy right on top of that SMAS. We cause a tissue contraction or a thermal injury, and then it starts sending those cells into repair, and it starts building new collagen and elastin. So we can use technology if it's more of a structural laxity. We can use other types of lasers if it's more superficial. So if someone's got crepey skin that's accentuating the marionette lines, we could use a fractional CO2 or an erbium laser. There are a number of different lasers that will cause a surface contraction and help reduce or minimize the actual lines here. One of the things that I did forget to mention is that as we age, or if you've had acne and you had a lot of acne around your mouth, you have scar tissue. The more scar tissue you have here, the more dramatic this marionette can be. And it's not just the muscle now, it's actually the skin. You know when you catch your sweater and it pulls a thread and you look down and you've got this thread pulling along your sweater? That's what's happening. The scar tissue adheres to the top layer of the skin and it pulls down, and you get this puckering of the tissue. Those are fibers, and we have to do something about those to allow that to pop up. So doing things like laser, doing when we're doing our injections, we actually do what's called a subcision, or we just move the needle in and out and it releases those. So it decreases the appearance of those marionettes. We've got PDO threads that are on the market that can actually lift up a little bit more, but it's not dealing with the structural problem. Remember, most of it is volume loss and muscle pull down, but then we assess other things that are going on with the skin. So we don't look at just those two things. Like when I do an assessment, it's everything. What's happening? How's the bone structure? And then we kind of work backwards from there. There are surgical options. I mean, obviously surgical options are not for everybody, but if this is dramatic and you've tried everything and you're not getting an outcome that you like, you could do what's called a lower facelift. And what happens is that surgeon will go in and they will do everything from lower face, and they'll do the bands and they'll pull the muscle, they'll replenish you with your own fat. I mean, it's a very extensive, and we can do a whole topic on that, but obviously doing a facelift or a lower facelift is really meant for more severe cases. And I would suggest if that's the case for you, then you go and get your consult, and they'll really explain to you if it's appropriate for you, if it's overkill, or if it's right for you, what to expect. The key thing that I want you to understand is that having marionette lines is a natural evolution of aging. We all get it. I have it, many of my friends have it, and there's really, there's not a lot of things that can prevent it, but once you start seeing it, we can actually manage the symptoms. Remember, we can deal with the muscles that are contracting by putting a neuromodulator. We can deal with the volume loss with a bit of a dermal filler. Obviously, the standard things you should be doing is sun protection, good skin care at a young age, hydration, avoid smoking. I'm never going to tell anybody to limit their alcohol, but within reason. Doing the gua sha, the traditional, it's not going to get rid of it, because remember, this is structural. I mean, it'll feel great, you'll increase blood flow, but you're not really going to see improvements of these marionette lines by just doing facial massages. One of the things that, I always try to address is the root cause. Why are these things happening? When I do a consult, I try to look at your lifestyle, what you're doing, and really educate you on the best procedure or the best treatment, give you pricing that's going to fit into your budget, because that's an important thing, and that we get the most natural looking results. I want to thank you for spending the time and watching this video. If you like this video, please subscribe. Feel free to share it with your friends and family. And if you have any comments or questions, put it in the comments below, and I'll be happy to answer your questions. See you next time.